More now on the coronavirus spike in Australia, with a record 502 new cases recorded yesterday. Federal Health Minister Greg Hunt joins us now. Good morning, Minister. And it is Mask Day. That's the message, isn't it?
It is, and for all people within the Melbourne and Mitchell Shire areas, I know it's very difficult, but our health workers routinely, and so many other workers, wear masks as part of their daily task. And so this is something that we can all do to help protect not just ourselves, but our parents and our grandparents, our neighbours and our friends and our family. And it's a difficult time, but it's a way that each of us can contribute.
We've just been having a debate here on the program, the epidemiologists who've suggested that it just doesn't make sense that joggers are exempt. Do you have a view on that?
Look, I'll leave this to the Victorian health authorities. I suspect that they've made a decision based on what they believe is the most practical. But wherever possible, within the rules, everybody must wear a mask. And if there are circumstances beyond those rules where people would like to do it, then we'd obviously encourage them to do it.
And would you do it? You're a jogger, aren't you?
Well, yes. Where possible, you do it. The question is whether somebody can breathe appropriately depending on their mask and their circumstances. So for me, my task is always to try to not just maintain the rules, but to do everything I can to protect my family and other people's families.
Pretty shocking figures yesterday with the numbers, but I think what shocked more people still is how many were not isolating when they were sick enough to get a test, then going into the shops. We talk about the message not getting through, but have we got the wrong message somehow? Do we have to rethink what we're doing here?
Well, always you're looking at what can help convey messaging to public, but the mask is such an important thing. But if somebody is sick, they must stay at home. They can go and get a test, but to do so in a way which is safe, and then to return home. Every one of us can help save a life or inadvertently risk a life. Maintaining the physical distancing, making sure that we're practicing the cough etiquette. But above all else, if you do have symptoms, stay home, only leave home for testing, and isolate until you get that result. They are the fundamental things that can help protect our parents and our grandparents and the spread from advancing around our community. That's such an important contribution everyone can make.
No doubt you've seen the reports this morning as well, Minister, suggesting perhaps a lockdown in Victoria that stretches months and months. What's your reaction to that? And do we have to prepare ourselves that this is going to go on for a long time, the lockdown period?
Sure. So right now, obviously, it's a 6-week period, and it will need all of that 6 weeks. Whether it goes beyond that, that will be a function of how we flatten that curve. We're not doing that yet. People are taking important steps, but we clearly have a very significant way to go in Melbourne and the Mitchell Shire to flatten those numbers. We've brought 1,400 ADF in to Victoria to help with that. We particularly want to make sure that this does not spread to the regions. There's an outbreak in Colac, which is very serious, and so the ADF is available to assist with testing, with tracing, significantly tracing, getting each case every day followed up. We're achieving this in 7 out of 8 states. We've stepped in to help Victoria achieve that outcome. They're the fundamental things, along with the individual distancing and hygiene habits, that will help us to flatten that curve for a second time. This is our great shared task.
How worried are you about what's going on in aged care facilities?
Completely focused. This is something that is, in terms of the risk to life, absolutely fundamental. We have stepped in as a Commonwealth to take over St Basil's, which is a facility which has had a significant outbreak. The advice to the Aged Care Quality and Safety Commissioner is do not wait, do not seek permission. Where you believe that there is a risk to the safety of residents, please step in, and Janet Anderson is fearless and decisive on that front. It's a difficult time for so many families. So our task through Surge Workforce is to help step in, to partner with Victoria and to providing that support. and to ensure that the resources are there in terms of workforce, PPE, oversight and hospital support wherever it's needed.
And all of it, of course, is adding to a sea of red when it comes to the economy. It's just going from worse to worse. The
expenditure has been very significant. Obviously, the Treasurer will set that out later on. Of all of the countries in the OECD, we're expected to have one of the absolute best economic performances. But for everybody in a global pandemic, it's hard. We are fortunate that we came into this in one of the strongest positions in the world, and we have made sure that what we're doing is investing right now with measures that are temporary for the course of the pandemic that don't burden the future. But we do know that we've had to make these investments to preserve jobs and, above all else, to preserve life, to invest in the health system, whether it's aged care, primary care, hospitals, all the supports to maintain our testing and our all the different elements that have been fundamental to protecting lives in Australia.
Greg Hunt, thanks for joining us.
Thanks, Lisa.